Look at your tongue right now. Right now, before you do anything else, pull out your phone, open the camera, stick out your tongue, and look at what is sitting on the surface. Most people see a thin white or yellowish coating and assume it is normal. Maybe you have noticed it is thicker in the morning. Maybe you have seen it change color after certain meals or when you are sick. You probably think it is harmless. I see a bacterial breeding ground. I see a toxic film that is directly connected to gum disease, stomach ulcers, respiratory infections, cardiovascular inflammation, and in severe cases, aspiration pneumonia that kills 50,000 Americans over the age of 65 every single year. 15 years of clinical practice, and I have watched patients ignore that coating until it contributed to conditions that radically altered their quality of life. And here is what makes me furious. The overwhelming majority of dentists will never tell you to scrape your tongue because there is no billing code for prevention. Your next dental cleaning will not include a conversation about the microbial ecosystem on your tongue. They will polish your teeth, tell you to floss, and send you home with a sample of toothpaste. Subscribe to my channel right now and hit that like button. We are working toward 1,000 subscribers, and we are building this channel on one principle. The system makes money when you stay sick, not when you get better. There is no revenue stream in teaching you that a 90-second daily habit can prevent chronic disease, but you need to hear it. Let me explain exactly what that coating is and why it matters far beyond bad breath. Your tongue is covered with tiny projections called papillae. On a healthy tongue, these papillae are pink, moist, and relatively smooth. But between those papillae, in the grooves and crevices, bacteria accumulate constantly. Dead epithelial cells from the surface of your tongue, food particles, proteins from saliva, and metabolic waste products from oral bacteria combine to form a biofilm. That biofilm is what you see when you look at a coated tongue. Now here's where it gets serious. That bacterial coating is not static. It is metabolically active. The bacteria living in that biofilm produce volatile sulfur compounds, the chemicals responsible for bad breath, but they also produce toxins, enzymes, and inflammatory mediators that get swallowed with every gulp of saliva. You swallow approximately 1:1, 5 liters of saliva every single day. That means you are continuously inoculating your stomach, your intestines, and your entire gastrointestinal system with whatever is living on your tongue. Research published in the Journal of Periodontology found that the bacterial load on the tongue correlates directly with the severity of periodontal disease. The more bacteria on your tongue, the more bacteria colonize your gums. Those bacteria produce enzymes that break down the connective tissue holding your teeth in place. Over time, that leads to gum recession, bone loss, and tooth loss. 1 in 4 adults over the age of 65 has lost all of their natural teeth, and tongue bacteria are a major contributing factor that almost nobody addresses. But it does not stop at your mouth. A study published in the European Respiratory Journal examined patients with chronic respiratory infections and found that pathogenic bacteria from the oral cavity, including tongue bacteria, were being aspirated into the lungs during sleep. When you lie down, saliva pools at the back of your throat. If you have sleep apnea, acid reflux, or weakened swallowing reflexes, small amounts of that saliva get inhaled into your airway. The bacteria travel into your bronchial tubes and lungs, causing chronic low-grade infection that over time progresses to bronchitis, pneumonia, or chronic obstructive pulmonary disease. Let me tell you about a patient I will call Robert. He was 62 years old, retired, generally healthy except for persistent bad breath that he had struggled with for years. He brushed twice a day, flossed regularly, used mouthwash, and saw his dentist every 6 months. His teeth were in decent shape, but the bad breath never resolved. It was affecting his confidence, his social interactions, and his relationship with his wife. When I asked him to stick out his tongue, I saw a thick yellowish-white coating covering the entire posterior third of his tongues. I asked if anyone had ever told him to scrape his tongue. He said no. His dentist had never mentioned it. I gave him a tongue scraper and showed him the proper technique. Within 1 week, he reported that the bad breath had decreased noticeably. Within 3 weeks, it was completely gone. His wife confirmed it. He said he could not believe that such a simple intervention had solved a problem he had lived with for over a decade. 6 months later, Robert came back for a follow-up. He told me something I had not anticipated. His chronic sinus congestion, which he had also dealt with for years, had improved dramatically. He had assumed the sinus issues were seasonal allergies, but once he started scraping his tongue daily and reducing the bacterial load in his mouth, the postnasal drip decreased, the sinus pressure lessened, and he stopped waking up with a stuffy nose every morning. The connection had never occurred to him because no one had ever explained that oral bacteria can migrate into the sinuses and create chronic inflammation. That is not anecdotal. That is physiology. The oral cavity, the nasal passages, and the sinuses are all connected. Bacteria from your tongue do not stay confined to your mouth. They travel. And when they colonize other areas, they create chronic infection and inflammation that the immune system struggles to clear because the source, the tongue coating, is never addressed. Now let me walk you through the 5 diseases directly linked to neglected tongue hygiene. I am not talking about theoretical risks. I am talking about documented clinical outcomes published in peer-reviewed medical literature. Disease number 1, periodontal disease and tooth loss. The bacteria on your tongue, particularly Porphyromonas gingivalis and Tannerella forsythia, are the same bacteria that cause gum disease. A study in the Journal of Clinical Periodontology found that patients with heavy tongue coating had bacterial counts on their tongue that were 10 to 100 times higher than patients with minimal coating. Those bacteria migrate from the tongue to the gums, where they trigger an inflammatory response that destroys the periodontal ligament and alveolar bone. Once that bone is lost, it does not regenerate. Your teeth become loose, painful, and eventually fall out or require extraction. Disease number 2, Helicobacter pylori infection and stomach ulcers. Research published in the Journal of Medical Microbiology confirmed that Helicobacter pylori, the bacterium responsible for the majority of stomach ulcers and a significant contributor to gastric cancer, can colonize the oral cavity, particularly the tongue. When you swallow saliva contaminated with H. pylori, you are reinfecting your stomach even after antibiotic treatment. This is why ulcers recur in so many patients despite successful eradication therapy. The reservoir of bacteria on the tongue was never eliminated. A study from Japan found that tongue scraping as part of ulcer treatment significantly reduced recurrence rates compared to antibiotic therapy alone. Disease number 3, aspiration pneumonia. This is particularly critical for older adults and anyone with swallowing difficulties. When oral bacteria are aspirated into the lungs, they cause infection. The immune system in the lungs is not designed to handle the same bacterial load that the mouth tolerates. A meta-analysis published in the Journal of the American Geriatric Society found that improving oral hygiene, including tongue cleaning, reduced the incidence of pneumonia in elderly nursing home residents by 40%. That is not a minor improvement. That is preventing a disease with a mortality rate of 20 to 50% in frail elderly populations. Disease number 4, cardiovascular disease. The bacteria on your tongue produce inflammatory cytokines that enter your bloodstream through inflamed gum tissue or even through the thin epithelium of the tongue itself if there are microabrasions. Once in the bloodstream, those inflammatory molecules contribute to endothelial dysfunction, atherosclerosis, and increased risk of heart attack and stroke. A study published in Circulation, the Journal of the American Heart Association, found that individuals with poor oral hygiene had significantly higher levels of C-reactive protein, a marker of systemic inflammation strongly associated with cardiovascular disease. Tongue bacteria are part of that oral hygiene equation, but most cardiologists will never ask about your tongue. Disease number 5, chronic kidney disease progression. This one surprises most people, but the connection is well documented. Chronic oral inflammation, driven partly by tongue bacteria, accelerates the decline of kidney function in patients with existing kidney disease. A study in the American Journal of Kidney Diseases followed patients with chronic kidney disease for 3 years and found that those with severe periodontal disease and poor oral hygiene had significantly faster progression to end-stage renal failure. The mechanism is systemic inflammation. The kidneys are filtering organs, and when your blood is chronically contaminated with inflammatory molecules from oral bacteria, the kidneys work harder, sustain more damage, and fail faster. Now, if you have sudden severe bad breath that does not respond to brushing, if you notice white or yellow patches on your tongue that bleed when you try to scrape them, or if you have difficulty swallowing or persistent sore throat along with tongue coating, see a physician. Those can indicate fungal infection, oral thrush, or other conditions requiring medical treatment. Everything I am discussing today applies to normal bacterial coating, not pathological lesions. So what should you do? The protocol is simple, but it requires daily consistency. Morning protocol. Before you brush your teeth, scrape your tongue. This is critical. You scrape before brushing because if you brush first, you spread the bacteria around your mouth instead of removing them. Use a proper tongue scraper, either stainless steel or copper. Do not use your toothbrush. A toothbrush does not remove biofilm effectively. It pushes it around and embeds it deeper between the papillae. Stick out your tongue as far as you can. Place the scraper at the back of your tongue, as far back as you can tolerate without gagging. Apply gentle, firm pressure and pull the scraper forward toward the tip of your tongue in one smooth motion. Rinse the scraper under running water. Repeat this 5 to 7 times, covering the entire surface of your tongue from back to front and side to side. You should see white, yellow, or even brownish material on the scraper after each pass. That is what you are removing. That is the toxic coating that was sitting in your mouth, breeding bacteria, producing inflammatory compounds, and getting swallowed throughout the day. After scraping, rinse your mouth thoroughly with plain water, spit it out. Do not swallow. Now brush your teeth as usual. Use a soft bristled toothbrush and fluoride toothpaste. Brush for 2 full minutes, covering all surfaces of your teeth and gently brushing your gums at a 45-degree angle. After brushing, prepare this mouth rinse. Take 1 cup of warm water, approximately 250 milliliters. Add half a teaspoon of sea salt and half a teaspoon of baking soda. Stir until dissolved. Swish this solution in your mouth for 30 to 60 seconds, making sure it reaches the back of your throat and all surfaces of your mouth. The salt provides mild antimicrobial action. The baking soda neutralizes the acidic pH that bacteria thrive in. Spit it out. Do not rinse with plain water afterward. Let the residual solution sit on your tongue and gums. Midday maintenance. After lunch, if you have access to a bathroom, rinse your mouth with plain water. Swish vigorously for 20 to 30 seconds and spit. This removes food particles and prevents them from accumulating on your tongue throughout the afternoon. If you cannot rinse, chew a small piece of raw ginger or a few fennel seeds. Both have natural antimicrobial properties and stimulate saliva production, which helps cleanse the tongue naturally. Evening protocol. Before bed, repeat the tongue scraping process exactly as you did in the morning. This is not optional. The bacterial coating accumulates throughout the day. If you go to sleep with a coated tongue, you are lying horizontal for 7 to 8 hours with bacteria multiplying in your mouth, producing toxins, and contaminating your saliva. That is when aspiration risk is highest. That is when the bacteria have the longest uninterrupted period to colonize and produce inflammatory compounds. After scraping and brushing, use this herbal rinse. Take 200 milliliters of warm water. Add 5 drops of tea tree essential oil or 5 drops of peppermint essential oil. Both have documented antimicrobial properties against oral bacteria. Swish for 30 seconds and spit. Do not swallow essential oils. They are for topical use only. This rinse reduces overnight bacterial growth and keeps your tongue cleaner until morning. Now let me address diet. Certain foods dramatically increase tongue coating. Dairy products, particularly milk and cheese, leave a protein residue on the tongue that bacteria feed on. If you consume dairy, rinse your mouth with water immediately afterward. Sugary foods and drinks create an acidic environment that bacteria thrive in. Minimize processed sugar. If you do consume it, rinse afterward. Foods that help keep your tongue clean include raw vegetables like carrots, celery, and apples. The fibrous texture mechanically scrubs the tongue as you chew. Green tea contains catechins, polyphenolic compounds with strong antimicrobial activity against oral bacteria. Drink 1 to 2 cups of green tea daily, preferably without added sugar or milk. Hydration is critical. If you are chronically dehydrated, your saliva becomes thick and sticky, which allows bacteria to adhere to your tongue more easily. Drink at least 2 liters of water per day, more if you are physically active or live in a hot climate. Proper hydration keeps saliva flowing, and saliva is your mouth's natural defense system against bacterial overgrowth. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Here is the timeline you should expect. Within the first 3 days of daily tongue scraping, you will notice that your breath smells better, especially in the morning. Morning breath is caused primarily by overnight bacterial growth on the tongue. Remove the bacteria and the smell disappears. Within 1 week, the coating itself will become thinner. When you scrape, you will remove less material each time because the bacterial biofilm has not had time to build up to the same thickness. Your tongue will look pinker and healthier. Within 2 to 3 weeks, if you had gum inflammation or bleeding when you flossed, you should notice improvement. The bacterial load in your mouth has decreased, so the immune response in your gums calms down. Inflammation decreases. Bleeding decreases. Within 1 to 2 months, if you were experiencing chronic sinus congestion, postnasal drip, or frequent throat irritation, you may notice those symptoms improving. The reduction in oral bacteria means less bacterial migration into your sinuses and respiratory tract. This is not a complicated intervention. It is not expensive. A stainless steel tongue scraper costs less than $5 and lasts for years. The entire process takes 90 seconds in the morning and 90 seconds at night. But the impact on your long-term health is profound. You are reducing your risk of gum disease, ulcers, pneumonia, cardiovascular inflammation, and kidney disease progression. You are improving your breath, your confidence, and your social interactions. And you are doing it with a tool that the healthcare system will never tell you about because there is no profit in it. The system is not designed to teach you prevention. It is designed to treat disease after it develops. There is no follow-up appointment for tongue scraping. There is no prescription to refill. There is no procedure to bill for. Your dentist makes money cleaning your teeth every 6 months, treating cavities, and performing root canals. They do not make money teaching you how to prevent those problems in the first place. If this video helped you, send it to someone you care about, a parent, a spouse, a friend who complains about bad breath or chronic sinus problems. You may have just given them a simple tool that prevents serious disease down the line. Your tongue is not just cosmetic. It is not just about bad breath. It is a microbial reservoir that directly impacts your gums, your stomach, your lungs, your heart, and your kidneys. 90 seconds a day. That is all it takes. And now you know why it matters.